Hello, this is Dr. Clarissa Barnes, and today I'm going to be talking to you about physician wellness, specifically achieving wellness and building a career that you love. So I know most of you, if not all of you already, but just for a little bit of background, I'm a board certified internist. I currently work at Avera McKinnon as a hospitalist, though I've done pretty much everything that an internist can do. I've done traditional internal medicine, I've done outpatient primary care, I've obviously done hospitalist work, nursing home work, urgent care, sort of the gambit. A couple years ago, I did take a certification course, so I'm a certified physician development coach. And I've done a lot of work, especially related to a prior role that I had as the light medical director for the Avera system, so the health and wellness program for physicians, nurse practitioners, and physician assistants at Avera for several years. I did that for about 3 years. And as part of that, I did a lot of talking about physician wellness, physician suicide, and essentially how you could use tools that you have for yourself in order to make your career better and what you wanted it to be. I don't have any relevant disclosures today. So for a little bit of background, because I have done a variety of different things over the course of my career, it's at this point been many years ago when I first started getting more into the what we would call now sort of the physician wellness space. There was a period of time not too long ago actually where to talk about physician wellness was not a very popular topic at all. And it was probably at this point almost 5 years ago when the first study was published that sort of indicated that physician suicide rates were higher than the general population in both genders, and even more so in women. And I remember at that time I was doing outpatient clinic practice, and I was reading that as part of sort of my day-to-day, sort of just keeping up with the current literature of what was happening in the world of medicine. And my first thought being, well, okay, well, that makes sense. And then being really sort of horrified that that made sense to me, that it should have been a more shocking statistic. And that sort of led me down the path of, well, why does the idea that, physicians, my profession, my colleagues, why do we have, why do we have, higher rates of mental illness? Why do we have higher rates of suicide? Why do we have higher rates of burnout? What is happening to us as a group? And how can I try in my small part to impact that? Which led me down a path that we'll talk about a little bit later with regards to South Dakota specific statutes, but eventually led me to become the medical director for the light program at Avera, which I did for about 3 years and recently stepped away from about a year and a half ago at this point. So today we're going to talk about a variety of things. We're going to start a little bit with some background on burnout and moral injury, just to make sure that we're all using these terms in the same way today, and we're sort of starting from the same ground point. We're going to talk about the current state of physician wellness, as well as how it's changed over the course of the COVID pandemic. We'll talk a little bit about some wins or some successes that we've had sort of on a state and national level. And then we're really going to dive into sort of the point of today, which is to talk about your own personal wellness, how you use, tools to help you identify what you actually love, and then how you can use that information to negotiate in your career for what you actually need to be a happy and a successful person. All right, so burnout. We generally consider the official definition of burnout to having three different components. You don't have to have all three to classify as burnout. One being sort of the emotional exhaustion, so feeling overextended, not feeling like you have anything left to give to patients, depersonalization, or feeling, unfeeling, not responding to the needs of the people that you're serving. And then personal accomplishment, or specifically feeling like, you don't feel like you're accomplishing much at work. You don't necessarily even feel like you're competent at what you're doing, generally feeling like you're spinning your wheels and continuing to work without any good outcomes. So, how do you recognize these in yourself? You know, Sometimes it's obvious, sometimes you'll catch yourself sort of saying something, either directly to a patient or about a patient, where you sort of find yourself referring to them in, a term where you're like, well, I wouldn't normally talk about people that way. Or sometimes it's just exhaustion, like you feel fatigued and tired, like you're doing all of these things and you still don't have anything left to give. You feel like there's more that's required of you and you don't have any capacity for that at this point. Or you just feel like you're not doing a good job. Like you feel like I'm working really hard, but I don't even know if it's making any difference. Would people even notice if I wasn't at work tomorrow? Like, is anything I'm doing even mattering? And then, you also want to be able to recognize that in others, so if you feel like people are constantly, saying that they're fatigued or they seem exhausted, or you feel like when talking to them about patients, they have a difficulty sort of empathizing with, different patients or family experiences, where they sort of like, I don't even know why they need that. I mean, it doesn't make sense to me, sort of things that you would see, and usually it's sort of uncharacteristic for sort of how you know them to be. You know them to be a caring individual, and you hear them saying things that don't make sense. Or, someone that is very competent, consistently saying things that make it seem like they don't feel like they know what they're doing. They're asking questions that they know the answer to, or they're needing to be sort of reassured that they know what they're doing. So moral injury, sometimes burnout and moral injury are terms that are used interchangeably. My personal opinion is that they're not interchangeable. I know a lot of people feel very strongly that a lot of things should be labeled moral injury when we call them burnout. Um, you know, Moral injury as a term first got applied in that article by Dr. Dean and Talbot, entitled Physicians Aren't Burning Out, They're Suffering from Moral Injury. And generally, moral injury is considered sort of to perpetuate or bear witness to, or to fail to prevent an act that transgresses our deeply held moral beliefs. Most of us come to medicine with a deep feeling of sort of the right way to do things and how we take care of people. And when we're not allowed to do things the way that we feel like they should be done, or in fact prevented, or there are barriers in place that prevent us from doing that way, it can really sort of hurt us, sort of on a deep, almost sort of soul level. Sort of a good example would be like, you know that a patient really needs this insulin, but the medical system is sort of inherently preventing you from getting the insulin to the patient who really needs it, and how that sort of eats away at sort of your core um, belief in what you're doing. And in general, we see a lot of this term sort of gaining popularity in the setting of COVID, for a variety of reasons that we'll get to in a little bit. So this is the, Medscape. The last time I talked to you guys at this point years ago, we use Medscape data as sort of the marker of burnout rates in physicians. This is the newest data that came out at the beginning of January. And the numbers are bad, and they're worse. Generally we would say that the average burnout rate was hovering sort of steadily in the 42 to 44% range, averaged for all professions or specialties in medicine. And now we see that number sort of making a big jump up in the setting of COVID. We've also seen some shifting in terms of who's the highest. So emergency medicine and critical care, who take a lot of the burnout or the brunt of the sort of initial diagnosis and management of our critically ill COVID patients, have made a large jump up to 60 and 56%. I do wish, internal medicine is higher than it was before at 48% versus sort of the, low 40s that it was before. I do wish that this data split out the different kinds of internal medicine, because I do think that primary care and hospitalists, internists are having very different experiences when it comes to COVID. And I would be personally curious to sort of see how that splits out. We don't have that data, but the numbers for everyone, us included, have gone up. So not great. Here I've got sort of both. So the one on the left, what contributes to your burnout? That's sort of, 2019-ish data. And then this one on the right is sort of 2022 data. So sort of comparing where we were before COVID and sort of after COVID. And in general, they haven't changed that much. We still consider the number one thing when it comes to burnout to be too many bureaucratic tasks, charting, paperwork, things that we think don't directly contribute to patient care, things we consider busy work, things that we think get in the way of what we need to be doing. There has been a general increase in things like lack of respect from administrator, colleagues, staff. That's taken a big jump up, almost 10% to 39% from 30% before. Too many hours of work is about the same. Loss of control or autonomy has taken a big jump up as well. And then obviously we've added some new things like stress from COVID-19 specific things, either treating COVID-19 patients or the actual stress of living in a pandemic with COVID-19, sort of issues with social distancing, not getting to see, family, friends, etc. Burnout also affects, us at home. Our family members often bear the greatest costs when it comes to burnout and our work troubles. Has burnout had a negative effect on your relationship? 68% of people, physicians say yes. And they often know if we're in trouble before anyone else does. Because ultimately, if you think about sort of the transition from burnout, I'm in a little bit of trouble to a lot of trouble, we usually save every, sort of additional bit of pulling it together that we can for work. And so home often sees the signs of trouble before work ever does. Um, the problem is that, even if our family and friends tell us, if they tell us our tells like, hey, I noticed you're not doing these things you normally do, or hey, you're getting a little short with us, or whatever, sometimes we ignore them. We try and minimize that, but you really do need to be tuned into what your family and friends are telling you because they know you the best and they're going to see it first. And a reminder that, even though we consider being a physician to be a very important part of our core identity, oftentimes we identify as, not I practice medicine, but I am a physician. Ultimately, if you leave your job tomorrow, they will replace you with another physician, right? But your family can't replace you. And so you really do need to keep in mind that you're the only husband, spouse, wife, mother, whatever that these people get. And so you do need to take care of yourself. So COVID, I don't think anybody's surprised that there's a large percentage of people who feel like they're more burned out because of COVID-19 than they were before. And I think, there's probably not a lot of shock that the more burnout folks that's hit women physicians harder than it has hit some of our men physicians. Not because it hasn't affected everyone, but because, the childcare responsibilities and difficulties that have come with COVID tend to hit the working mothers a little harder um, than other subsets of the population. There's some people that said it was the same, very small percentage of people who say less. I would love to know who those people are. Um, I don't know that I know any of those people, but um, so the question becomes, is what's happening with COVID more burnout, more moral injury? I think probably honestly it's both for different, and it may be one more than the other for different people. We do know that the risk of burnout was 40% lower for those who felt like, in their healthcare organizations, they felt like they were being valued. I don't think that anyone's shocked by that. I know a lot of physicians, in the state and across the country, where when COVID happened and the initial part where there was a lot of financial stress, there were certainly physicians whose message from their administrators was, you know, well, everybody's taking a pay cut and we don't care that you're working harder and seeing more COVID patients in the hospital and there's increased risk to you. We don't find any value in that. There were a lot of people, I think, who were, felt like they really got a better understanding of the organization they worked with based on sort of how they dealt with the financial pressures of the early pandemic stages. Some people really came out of that saying, my organization really respects me and they're really trying hard to make everything work. They're being really transparent. And some people walked away from that saying, I don't think that they care about me at all. And if they didn't feel like they were cared about or valued, then obviously those people were more prone to burnout. There's a lot of secondary and tertiary issues with COVID, right? There's the actual medical issues of taking care of patients and a lot of worry that a lot of physicians had, especially in the early days about, am I going to get sick? Do I need to worry about my own health? Do I need to worry about taking this home to my family? I'm going to move out into the guest bedroom, or I'm going to move into a camper in my driveway, or I'm going to move into a hotel. I want to make sure everybody's safe. Um, and then doing all of those things and then sort of having this, what I call the second front of COVID, the I'm doing all these things and I've got family members and friends who are acting like COVID isn't real, or that I, as a physician, are part of this giant machine that are manufacturing this crisis for some sort of personal gain. Which, when you come into medicine with the idea that I'm really trying hard to help people to have the people you're trying to help essentially act like you're trying to harm them or pull one over on them can be really hard on your emotional self. As a result of this, we do see, the recent numbers are that 1 in 5 physicians say that they're likely to leave practice in the next 2 years. This idea of the sort of great resignation that people talk about in America, uh, physicians are not immune from those pressures and those feelings of, hey, maybe I don't want to keep doing this job, or maybe I don't want to keep doing this job for this particular, organization. Certainly we've seen a lot of nurses leave medicine, either to become traveling nurses or to leave the profession entirely. I do think that they are a little bit like the canary in the coal mines for us. If you think about physicians, it's very difficult for physicians to sort of immediately quit, especially early to mid-career physicians who still have a lot of debt. Those sort of quote unquote golden handcuffs are real. So even if a physician said, I don't want to do this anymore, I need out, it probably is going to take, a planning period of, a couple years to make sure that everything's financially in place to allow them to do so. So I don't think that, I think there's some people who feel like, well, the physicians haven't quit yet, so we're okay. I think that that's probably not going to be true. I think actually that a lot of physicians are probably going to end up, following through with what they're saying now, unless there's some significant changes in their workplace environments, unfortunately. All right, so that's a lot of that's not so great news. So let's talk about some things that are good news, right? Because it's not all dire. So the South Dakota win that I'm, I'll be honest, personally most proud of, I suppose, is that we did at the beginning of the pandemic finally get the mental health disclosures changed. So when you apply for your medical license in South Dakota or you renew it, you have to fill out these disclosures and they ask you all these questions and you have to say yes or no. And prior, so this is the prior number 15 and prior number 16, these are the questions that were relevant. They would ask you, do you have a physical, mental, or emotional condition which may adversely affect your practice? And then they would say, okay, have you been treated for, or do you have a diagnosis for any mental health condition? So essentially that meant that if you'd ever been diagnosed with, postpartum depression, anxiety, if you'd been not diagnosed, but, treated, they gave you an SSRI once, whatever it had to be, even if it was 20 years ago, even if it never impacted your ability to practice, you still had to say yes, and you still had to ask your treating physician or whoever it was to send a letter to the board office saying that you were safe to practice. Which, as you might imagine, and I know most of us are not surprised to hear, meant that a lot of people would try really hard not to get diagnosed. They would try really hard not to be in a position where they would have to answer these questions later because they didn't want to worry about their licensure. This is their livelihood. It was very important for them to still be able to pay their bills. And so they would try and sort of just suffer on through it. Or if they finally said, okay, yes, I'm going to get treated, then they had all these additional hurdles and felt sort of, a lot of stigma related to, now I've got to disclose this thing. I didn't think it was a big deal because it didn't ever affect my ability to practice, but now I have to go through all these additional hoops. So they did change that. And so now the disclosures say, are you currently suffering from any condition for which you're not being treated that impairs your ability to practice medicine in a competent, ethical, and professional manner? So you no longer have to state, I've been treated for mental illness or a mental health concern, and you don't even have to specify. There's no, specific mental or emotional condition questions at all. It's just generally, is there a condition that is currently impairing you? So if you're being treated appropriately and you're not impaired, then great. They don't need to know about it. But if you are, then that's something that will, prompt some additional questions. But for the most part, this sort of gives people a bigger buffer period or buffer area to be able to say, okay, well, I do want to do something about my depression. I do want to do something about my anxiety. I do want to see a psychiatrist. I want my primary care doctor to prescribe medication, or I want to go to therapy, whatever it happens to be, which I think. Additionally, the SDSMA, as well as other people, have been working together on additional resources for South Dakota physicians, and they've been working with the health systems to provide some of that additional, so we're all working together. So be aware that that is coming down the pike in the future. So that is some great news for us. I know a lot of people, if you already work for a health system, oftentimes you have some sort of resources, like, for example, Vera has the Light program, But I also know that a lot of times you don't want to go to a program that's related to your healthcare organization. You'd rather go to something that is a little bit more, third party. And a lot of physicians don't work for the health systems. They're, independent or have their own clinics or whatever. And so this gives us a better way of sort of making sure that we're getting everybody some resources. Additionally, on a national standpoint, the Dr. Lorna Breen Healthcare Provider Protection Act was recently passed, which is a great step forward on a national level. And honestly, even 5 years ago sounds like, would have been an impossibility. I think probably most of you know, but sadly, Dr. Lorna Breen was a physician out on the East Coast, emergency room physician who died by suicide in the setting of the COVID pandemic and her own COVID diagnosis. And I think, her family has been very strong advocates for the fact that they really think that that shouldn't have happened. It shouldn't have happened, right? People should have been, more clued into what was happening, and that we don't necessarily have good, standard of care for sort of how we make sure we're taking care of physicians and other healthcare workers. So there's sort of 5 different areas that this act deals with. So it establishes some grants. Um, so for training students, residents, etc., and how strategies and how to reduce and prevent suicide, burnout, mental health conditions, etc. It's also sort of, seeking to identify and disseminate some evidence-informed best practices for reducing and preventing suicide and burnout, which is great. Some national evidence-based education and awareness campaigns targeting healthcare professionals to encourage them to seek support and treatment. Some grants for employee education, some peer support programming, and then some of that will be targeted to sort of, areas where COVID-19 was really a hotspot or heavily hit. So there was a lot of additional stress in those areas. And then establishes a comprehensive study on healthcare professional mental and behavioral health and burnout, including the impact of the COVID-19 pandemic on such professionals' health. So, some of it is funding. So some of it's money going to be devoted to the study, but also some of it's going to be education and trying to really get sort of, evidence-based standards for sort of how do we approach this as an industry and profession, which is good. So in general, if you think about burnout, there's everybody wants, I want everyone here to be well, right? So we think about well-being, and there are things that you can control sort of as an organizational, so whether it's your individual team, it's your individual clinic or hospital site, it's the health system that you work for. And then there's sort of like individual factors, like what you can do for yourself. And the last time I talked to you guys, we talked a little bit more about sort of, from personal to big system things. And today we're really focusing on just individual factors or things that you can directly control in terms of making your life better. So what can you do, right? Because it sometimes feels like, at least, it has for me, and I suspect for a lot of you, that sometimes the problem is so big that, like, how could I possibly make an impact in this whole profession, right? And oftentimes, personally, we can feel sort of trapped by what I referred to before as sort of the golden handcuffs, that we're so stuck because of the debts that we carry for education, and then maybe some of the debts we accumulated afterwards, like, well, I've got this mortgage and I've got this car payment, my kid's going to college, like I have all this money that I have to be making, that I feel like I have no other option and then to continue doing what I'm doing. But I'm here to tell you there are always options. uh, no matter how hopeless or, no other, light at the end of the tunnel for you that you feel like it is, there are always options. And if you feel like there's no options, there are options, I promise. So right now, so this is the same sort of thing before, where we've got the older data from 2019 on the left and the newer data from 2022 on the right. This is what physicians, what they are doing. So how are we dealing with burnout? Good news is exercise still remains number one. So yay, 48% of us, say, okay, if I'm burned out, I'm going to exercise more. And used to be talking with family members, close friends was next. We've sort of seen a little bit of a swap where now isolating is the next highest thing, which is not great, especially when we think about sort of suicide risk, right? We don't want people to be more isolated. We want them to be more connected. And then, we sort of go down the line where it's like, well, sleep, listening to music, and then some less, productive things, right? Like eating junk food and drinking alcohol and binge eating, et cetera, et cetera. I don't know what the other sort of 12% is on the right here. Once again, I sort of wish there was an of isolation. So we're going to talk a little bit about some tools that you can use. I will tell you that these come from a coaching standpoint. And, I don't want people to think that, oh my goodness, coaching is, the answer to everything, because it's not. But it is an efficient process to sort of help people who are high performing, which physicians always are, improve things in their life in a very specific way that they can then sustain over time. So it's really good for, like, if I just want to help figure out what my values are, I really want to figure out what the next step is, I really want someone to hold. Like I said, there are some limitations. So coaching is evidence-based. There are studies, this is one of them, that shows that the rate of burnout decreases by 17% in the group getting coached, and increases in the group that's not getting coached. Quality of life improves, resilience improves, emotional exhaustion decreases. That's all very good, right? So I do think coaching can be very helpful. However, coaching is not the same as therapy, and I do think that sometimes we blur the lines a little bit, right? So if you are stuck in a job where you're not happy and you're not sure why, and you need to know what the next thing to do is, or hey, I'm having this problem at home, I'm having this trouble, with my kids, or like, if you're looking for sort of some like reflection on what you feel like you should do the next thing, then coaching is great. If you're, in the process, in a place where you sort of have severe depression, if you are worried that you might harm yourself, if you have anxiety to the point where you're, having changes in your weight and you might need medication, like, then coaching is not the answer to that. Sometimes coaching can be helpful with that, but what you really need is, a physician's care, potentially medication, potentially therapy. So what we're really trying to do with these tools is we're really trying to find, the overlap, right? The little red dot in the middle, your purpose, the things that, you're good at and you love and that you can get paid for and that someone needs, and that sort of, combination of like where you're actually supposed to be in your life. And ultimately, the reason for that is that if you know what you're supposed to be doing, then it actually isn't that hard to make decisions. And when you know what your values are and what you really find important in your life, some things that initially seem unclear become very, very clear. All right, so this is the Wheel of Life. And hopefully you got an email with the actual paper copy that you can do yourself. If not, you can sort of scribble it on a scrap piece of paper. That's fine too. So in general, it looks like a big old pie. And you've got, essentially 8 different pieces of the pie, and each piece of the pie represents something about your life. So in this one, we've got career, money, health, family, significant other / romance, personal growth and learning, friends and recreation, and then your physical environment, like your house, your apartment, wherever you live. And on the right, there's an example. So essentially what you're going to do is you're going to take every piece of that pie and you're going to rank how things are today, not like, don't try and average it over time. Don't try and think about last week. Just think about how you feel about things today. 0 being very bad, 10 being perfect, wouldn't change a thing. And then sort of, once you sort of mark where you're at, sort of fill out the pie with sort of the lines like they show on the right. And the idea being that it maybe will help clarify what parts of your life you're happier with or not happier with. Because I think sometimes what happens is we find that one area is the part that we focus on, but there may be several areas that aren't quite right, or one area sort of becomes the scapegoat for other areas, right? So like, hey, I'm having a lot of trouble in my marriage, I'm having a lot of fighting with my spouse. But when I really sit and think about sort of what's happening is I'm fighting more with my spouse because I'm really unhappy and feel unfulfilled at work. So sometimes making yourself sort of like take an inventory of everything in your life helps you sort of refocus and say, okay, well, where are the big problems? And maybe the problem I thought was the biggest problem isn't the biggest problem, or maybe it's multiple areas. You just sort of have to do it and sort of see. And sometimes it can be a really good tool for, okay, well, this is where I need to focus. So, hey, the thing that came out the lowest was really my home environment, because I feel like I can't keep up with my chores. The dishes are never clean, the laundry's never done. Like that's the thing that is really driving me, the you know, makes me feel unsettled when I'm at home. So that's what I'm going to work on, right? And so you come up with a plan. Maybe you've got a chore chart, maybe you're involving the kids, maybe you actually hire someone to come in once a week or whatever it happens to be. I'm not going to tell you what the solution is because you have to make up your own mind about your own solutions. And then maybe, 3, 6 months later, you fill out the wheel again and say, okay, well, where am I at? Now I'm really happy with this. And now I've identified that actually this other area is the part that I need to focus on now, or maybe now everything looks pretty good and I'm happy generally, you know. So in general, I would say that this is a very good overall tool to sort of figure out where you're at. Um, and then once you've sort of figured out what you need to work on, or what's, giving you the most stress, or not quite right, or not consistent with what you want, then you move on to sort of other tools to figure out, okay, well, what am I going to do about it? So this is a very big chart. And this is a list of values. So it's not an inclusive list of values. If you have a value and you feel like it's not on here, like, that's okay, you can add it. But the purpose of this is really to sort of say, okay, what is important to me? And generally, you're the only person who's going to be able to tell you what your values are. There's no right or wrong answer, right? Sometimes we feel pressured to pick something as a value because society tells us that it's valuable, which may or may not be true for yourself, right? Like, so sometimes we, like family becomes one of those ones where it's like, well, of course, my family has to be number one. But maybe your family is very important to you, but maybe it's not the number one value for you. Maybe, it's something else. Maybe it's independence, or, hey, I'm supposed to feel bad if money is an important value to me, but maybe money is important to you, and earning more money is something that motivates you in your life. So it's really not about a judgment call. It's really about sort of you deciding. And generally what I find to be helpful is if you take a list, look at a list like this and sort of circle, like, probably the top 10, like 10 things that really speak to you. Like, these are the values of my life. And values should not be changing, right? In general, like the things that you find valuable or and help guide you, are sort of inherent to your core and to your person. And so they're not something that changes, well, Tuesday I said this, but then Wednesday I felt differently. Like, they really should be sort of consistent internally. And you may find that, it's helpful to rank them a little bit to say, okay, well, these are the top 5. And you don't have to be super specific. It doesn't matter if something's 1 versus 2, but just to say, okay, well, these are the 5 most important values, and these are the 5 really important values, but not maybe my top values. And the reason why it's important to sort of know those is that if you're really honest with yourself about what your values really are, it helps you make decisions better now and in the future, right? So I think the best example I can think of is that, I see it all the time. Like, you go to these like Facebook groups, right? And people will post like, I have job option A and I have job option B. And then they, lay them out in terms of like, responsibilities and salary and time off. And then they ask this group of like 10,000 strangers, like, which one should I pick? Right. And oftentimes the best part is when they like post it anonymously. So you don't even know anything about this person. And, ultimately it's like, I honestly can't tell you which job you should pick because I don't know anything about you or your values. This one may look better on paper because it's more money, but if what's really important for you is the ability to get, a 2.5-day weekend by getting Friday afternoons off so you can do these like big bike trips through the mountains, like, you know what I mean? Like, more money won't make you happier. You need that, Friday afternoon, or you need like the job that's going to give you the ability to teach residents because teaching is really important to you. And so it's really impossible to make decisions unless you know what's really important to you. So I would encourage you, like I said, if when we were planning to do this conference in person, I was going to have us do some of these things like in the room and then do some mini coaching with each other. Obviously, that's not going to work out because now we're virtual. So you're going to have to do it a little bit on your own. And then the next part is sort of figuring out, okay, how am I going to use those in practice, right? So generally what I tell people to do is to think of a time or maybe a group of times where you felt like really excited or energized, or even like just think to yourself, when is the last time I came home from work and I was like, I had a really good day. Today was a great day. And it may take you a while to really think about like what that day or time was, especially, now with COVID, a lot of people are sort of saying, well, maybe there isn't a lot of really great days right now, you know. But in general, you should be able to think of a time in your career where you're like, that day was great. And then I want you to write down, okay, so when was that? What was happening in that day? Like what were the things that you were doing? And then I want you to take that experience and compare it to your values and say, okay, which of my values was I using or finding, consistent with what I was doing at that time? If you find that that really great, perfect work day was one where you were, on a teaching service and you had a resident and you guys like really sat down and went through a differential and then came up with the diagnosis for something that was really tricky, and that felt really good because you did it, but also because you were doing it with the resident. And like maybe you go back to your value list and you're like, teaching is one of my core values, and this was something where I really felt like I was teaching, but it was also part of this other core value, which is, learning new things, and I had to sort of investigate some new tests I didn't know about in order to get this done. And so I felt like I was teaching, but I was also learning. Oh, okay, well, those values are really important to me. And that's why that day was really great for me. And sometimes it feels, a little bit oversimplistic when you sort of say it like that, but actually, we don't often reflect on why did that day make me happy, or why did that experience make me happy, or why did that thing that I do resonates so strongly when this other thing didn't. But it is really, really important. And so that I want you to do that. And then I think actually doing the converse is true too. Like think of a day that was really, really terrible. When was it? What was happening? And why? Maybe your really terrible day was because you were trying to get somebody transferred to a different hospital and they didn't have a bed and this person was getting sicker and you really felt like you couldn't do anything, and you realize it's because I feel like I didn't have any control that day, and being in control is something that's really important to me, or whatever. And like I said, sometimes these things can be helpful. You don't necessarily need to even do them. You can do them yourself, but you can also do them with somebody else in sort of a reflective way, even if that person's not technically a coach. If you All right, so what do we do about that? What have we done to try and alleviate burnout? This is, like I said, 2022 data. Participate in meditation, reducing hours, that's 29%. That's a large percentage of people reducing their work hours. Change work setting entirely, people going from outpatient to inpatient or vice versa. Made workflow or staff changes to ease up my workload. Spoke with the administrator about productivity pressures, hired staff, sold the practice. So what can we do? So first one, you can reduce hours, right? So that's something that was on the other slide. You can say, look, I'm not gonna, and for some people, reducing hours doesn't even necessarily mean dropping below full time. There's a lot of people, we're an internal medicine group, a lot of people who are doing inpatient work, or outpatient work, who've been doing more than a full-time job, right? Like picking up extra shifts, picking up additional work. Maybe reducing hours just says, I'm not going to volunteer to pick up extra work anymore. Maybe I'm going to try and stick closer to what my initial, sort of contract was. Or maybe it is going, I need to do 50% or I need to do 75%. It can be trying to find, doing more of the activities that you love. If you learn through the prior exercises that, hey, teaching is really important to me, but I don't have any regular teaching. It just happens like, when we get a med student once every 6 months. Maybe I need to do something where I have more regular teaching. Maybe it's I volunteer to do an inpatient week with a student. Maybe I need to, change my practice settings so that I can get more teaching because it's really important to me. Can you get more help? Can you get a scribe or someone else to help free up your workload? Can you exchange your clinical time, some of it for another activity? You're saying, look, I like my clinical role, but maybe that's not the only thing I want to do. Maybe I want to do that 75% of the time, and then 25% of the time I'm going to do, and you can change the work environment around you. You can try and foster a positive culture around you, invest in the people that you work with. I know it's hard when you're sort of stuck in your own, burnout box, but you can also sort of be sometimes fixing or helping ourselves is part of actually helping other people. Noticing that, hey, my MA or my nurse is also really burned out, and maybe I just need to ask her and see if I can help her, and maybe that will help me. Ask why and really listen, and then advocate for change. If you know that there are, bad staffing models happening and that's why your nurse is burned out, then feel free to, like, step up and advocate for. A lot of times physicians, part of what we really need is we need an opportunity to, feel like we're really accomplishing things, leadership opportunities. You don't have to get that through your employment, right? You can volunteer with the ACP, the SSMA, other professional organizations. You can volunteer for a community organization, food bank. You can run for office, get a new hobby. And then you can also, see if you can get more help at home. Can you negotiate something with your family so that they're taking some of the burdens away at home? Can you make sure that everybody's on the same page? Can you make sure that you're setting time for your family that's protected, even in COVID, even when you're picking up extra shifts, or protected time for yourself? And then the final question is, maybe you've done all those things. Maybe you've made what changes you can at work. Maybe you've increased your support at home. And maybe you're looking at your things, yourself going, when is it time to leave? And so this is actually from a pretty recent Harvard Business Review article. When is it time to leave your job? If it's no longer encouraging your growth, if you've sort of done what you set out to do, which becomes less of an issue, in sort of clinical practice. But if you're actively looking for ways to avoid your job, you regularly approach your job, with exhaustion, burnout, or dread. If your job is causing you to develop bad habits, you feel like you're starting to, drink too much or do other things that you're like, man, this is really not a good habit for me, and I don't know why. Or even if it's just like social habits, like I feel like I'm learning, I'm starting to do more gossiping or other toxic behaviors that really don't feel like me, that may not be the right environment for you. Or if in general your workplace is just toxic. So how do you actually decide? I mean, part of that is that in general, if you're going to make the decision to either leave your job entirely or just leave part of it and to do something else, you should always make sure you're running towards what you love, that you've made a decision like, I really love teaching, I want to do more of that. Not just, I need to do something different. Anything different will do as long as it's different than what I'm doing. Because if you just pick something randomly, the burnout will likely follow you because you haven't necessarily identified what you need to be happier. So you need to make sure you're making changes deliberately, that you're saying, look, this value is really important to me. I'm not getting it met in what I'm doing. I'm going to do this other thing that will meet it. That's how I know I'm going to be happier in this other job. And make sure that the changes are based on your values. Don't do things because society tells you that that is an important value. Don't do something just because it's going to make you more money if it doesn't make you happier. Don't do something conversely because, well, the everybody's internet, inspirational memes tell me I need to spend more time in nature, and so I'm going to move to a place in the mountains so I can be more, around nature, when in fact you don't actually like that. And you should be aware of competing interests, right? So you're trying to make decisions based on your values. You may go to other people for advice, and those people may be people that you normally would go to, someone at work or your spouse. But you should be aware that they're going to have competing interests. If you feel like you need to leave this job because it's, important for your mental health, your spouse may not want to move, right? So you need to keep in mind they may have competing interests when you're discussing this. Or if you're talking about, job changes, your job may not want you to change things because they may like your productivity where it is. But in general, I want you to remember, and I cannot stress this enough, you and your life are more important than your career. Even if it feels like you're making a mistake from a career standpoint, but you've decided that you need to do it in order to be happy and well, and to make sure that you're living a life that you want to live. So in general, to sort of summarize, is make sure that you do know that there is the National Suicide Prevention Hotline. You should know that there's a physician-specific support line. That's their website and their phone number. I will take any questions.